Yo, 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 yo. What's going on, y'all? It's the Great Lakes Livecast. Lorenzo, Rap Sheet, Douglas, man. We back at y'all. I think it's what, our 8th episode, D, or 9th episode?
Yeah, somewhere in there.
Yeah, we climbing, y'all. I'm your host, Lorenzo, Rap Sheet, Douglas. This is my co-host, y'all already know, D5000 Watts. And we at y'all with a serious topic here, you guys. We touched on this in the beginning, a couple episodes back, and we got a lot of feedback on it, man. You know, a lot of people was saying that they was happy that we touched on it, and we've been seeing. You see a lot of this in just the current event that's really going on in today's society, and that's mental health, man. You know, it's very important, and it's just something that kind of affect everybody. You know what I'm saying? I'm pretty sure it affect you in some type of way, unless you rich or something. You know what I'm saying? You know, or if it don't affect you, it affects somebody you know and love. So, this is a serious issue. We just want to climb into it and touch back on it, and give some tips on it, and some stuff about what we know.
Definitely. Mental health is just as important as physical health, influencing overall well-being. 1 in 4 people globally experience mental health issues at some point in their lives. The stigma surrounding mental health can hinder open discussion and seeking help. Various factors contribute to mental health, including genetics, environment, and life experience.
Yeah.
So, I pass that to you.
Yeah, that's you know what I mean. That's just the real spiel, man. And like I said, we've all experienced some type of mental health issues, man. Personally, I just want to say this, man. Like, I feel like this, D. We all, at some point, man, we done been at the point in our life where, man, we just one thing away from flipping out, man.
Yeah, definitely. Several times.
You know what I'm saying? We one bill away, or one person's motherfucker saying something to us not that we don't agree with, and just throwing it all away, like, man, fuck it, man. You know what I'm saying? We all have been at that point, man, where you ready to just crash out, bro. You know what I mean? So, like I said, we all experience some type of mental health, man. And since we touched on this subject, like I said, we got a lot of people, a lot of feedback, man. People, happy that we spoke on it. So we actually reached out to some people, some of the people we know, they gave us some people that they know, and just kind of networked for us. And we got some real expert opinion and some expert input on the subject. We actually got a young lady, Mrs. Siobhan Dupree. She's a licensed social worker for over 11 years. She has experience working with patients in long-term facilities, rebuilding family and community relationships, providing resources and supportive counseling for ex-offenders. She's a really smart lady. She has credentials. She has a bachelor from Cleveland State in social work. She has a master's from Delaware State University, and she recently started her own private practice working with adults that struggle with independence due to various personal, medical, and professional losses. So we want to just thank her for helping us get some of this information and helping us get it out there to the people. Definitely. This is somebody that our last guest, Vino. You guys remember him, BG, with the cowboy hat. That's his signature. He actually helped out him and his wife, and they reached out and found somebody, to give us an expert opinion. What would you got, D?
I would say that a lot of contributing factors is just like everyday things, as far as like maybe one main everyday factor that can contribute to somewhat mental health is money, or lack of having it, or worrying about bills, worrying about how you're gonna get your next meal, how you're gonna survive, pay rent, things of that nature. A lot of times personal things like that can cause slight mental health, but then also things that take you into deeper mental health is substance abuse, alcoholism, drinking a lot, You know what I'm saying? And just sometimes just, making bad decisions can, turn you around that corner. But we're gonna stay away from that right at this point. But I just think that overall mental health is just it's a problem. It's a problem in our communities right now. And I've seen it firsthand, doing community service. I've done community service and volunteer work at Catholic churches in my neighborhood, and I've seen it firsthand. And a lot of the people, they don't have a lot of family support. A lot of them don't have a lot of family support. They don't really have people checking on them, and so they're pretty much out here on an island by themselves, and the only support they're getting is from the Catholic Church. Every day, that's where they eat their meals, that's where they sleep at, that's where they sleep in the wintertime, that's where they, take their showers and get their clothes from and stuff like that. So it's just a real problem, and it's a continuing cycle, and we all probably have to pitch in and help to try to get that, get this kind of under control.
Yeah,
and
exactly.
that's why we bringing awareness now, and then we trying to play our part in the fight.
Yeah, I agree, D. Yeah, and so basically, you saying that the people that you see, like you said, you do some volunteer work around homeless people and stuff. So you kind of see one of the main factors is they don't have family and friends checking on them and stuff like that.
Yeah, definitely.
Yeah, I agree with that, man. This is just my personal theory. I believe that a lot of us that experience, and I say us because, like I said, I think we all kind of experience some type of mental health issues. But I think one of the things that keeps us kind of grounded a little bit is family and friends, man. You know what I mean? Like if one of your close friends or family members, if you kind of see them going off the deep end, that you there to kind of reel them back in. And also they know that they can't go too far off the deep end because of accountability. You know what I mean? Like if I get to acting crazy or doing something crazy, my dudes, my niggas, my dudes, they gonna be like, man, what's up with rap? Like, you know what I'm saying? So you kind of gotta try to keep yourself in pocket a little bit. So with that being said, man, kind of check on it ain't always hating or it ain't being in somebody else's business, man. It's kind of like if you care about this person and you love this person and you see them doing something that is out of character, if it's your place, if you got that type of relationship with them, you might just want to say, hey, man, you know what I mean? Like, what's going on with that? That's something you want to talk about, or because I don't feel like that's in your character. You know what I'm saying? And we didn't all have somebody, or we should have somebody like that, man, that can kind of, reel us back in, man. Because I'm gonna get to some notes. A lot of people be saying, man, we don't like you reading off the paper, but this was a lot of information, and I want to get it out there, man.
Definitely.
So research has shown, that mental health can be passed down, and it's hereditary, man. So mental health disorders are health conditions that affect how a person thinks, feels, and acts. These disorders can impact a person's life in significant ways, including how they cope with life events, earn a living, and I feel like most importantly, relate to others.
Definitely, I agree.
Yeah.
I agree totally. And I think that adding to that, I would say that there needs to be a level of forgiveness and a level of understanding, because a lot of times it's not pleasant to be around people with mental health, and that's probably why family members don't come around, or it may be because of something in the past that the person may have done or whatever. But sometimes you have to forgive and forget and continue trying to help and continue, trying to do good work, and,
yeah, exactly. Especially if the person, put the mic right here so the people can hear you. Especially, man, if the person is kind of suffering a little bit from mental health, man. You can't hold them accountable because they not in their right frame of mind, man. You know what I mean? And most of the stuff that they doing, they wouldn't be doing it if they was in their right frame of mind. So you got to kind of think about that too, man.
Yeah, definitely.
Certain mental health disorders can be passed down and tend to run in families, man. Having a family member with mental health issues could mean you're at a higher risk for getting those same things. It's actually passed down in your family's genes. You know, so if you got somebody in your family that's, you know, has mental health issues, that's something that you might want to, you know, stay on top of as you get older, man. Scientists, they can't yet test you and determine if you're going to develop certain mental disorders due to gene mutations. So that sounds deep, you know what I mean? So the genes that's in you that do cause mental health disorders, they mutate. You know, I guess so they can't pinpoint them and see if you're going to have the same exact thing.
Definitely. Mental health is a spectrum, and everyone's experience is unique. So, with that being said, you just want to, sometimes you got to deal with the different people differently. You can't, every situation isn't the same, and you have every situation being unique. You have to deal with different people in different ways. You can't, just like with a doctor treating people, you can't treat every situation the same, because all situations are different. So you have to be different in how you treat mental health with different people. The same approach doesn't work for every single person.
I agree. I totally agree, man. These are some forms of mental health right here. I'm pretty sure it's a lot more, but these are like some of the main ones. You have clinical depression. The mainstay of treatment is usually medication, talk therapy, or a combination of the two. Anxiety disorder treatment includes counseling or medication, including antidepressants. So that also go back to what you were saying, D, about the medication nowadays. You know, they making so much money off these medications, man. You know what I mean?
Business.
Yeah, it's business.
Big business.
Big business, yeah. Okay, this is a more serious one. A bipolar disorder. The treatment is usually lifelong and often involves a combination of medication and psychotherapy. So that's kind of deeper, deeper into it. Dementia, which is like kind of when people lose their memory and, they don't remember their loved ones and all of that type of stuff. That's kind of personal. I know somebody whose mom actually is suffering from that. So, shout out to her. Hope her family and her mom get better. The medications and therapies may help manage the symptoms. Some causes are reversible. So, that's something positive that, some of it is reversible.
Definitely.
Attention deficit and hyperactivity disorder. Treatments include medication and talk therapy. Now this one right here, D, I feel like, what do you think about that one? Attention deficit and hyperactivity disorder. Do you just feel like that's just like a person or a kid with a lot of energy?
Yeah, that's what I feel. I feel that's just a kid with a lot of energy.
Yeah.
And he just needs a lot of activities. He need to be playing football, need to be playing soccer,
yeah.
basketball.
Yeah, I think that's
swimming, everything.
I like way take it offensive that they even got this with the rest of the stuff, man. Because the rest of some of this stuff is serious. You know what I mean? I just feel like a person with a lot of energy. I don't want my kid on no medication, like you said. Just put them in some type of sports or something, man.
Exactly.
On a more serious one, I got a couple more. Schizophrenia, which is a serious one. You know what I mean? That treatment is usually lifelong and also involves a combination of medication, psychotherapy, and coordinated specialty care services. We got obsessive compulsive disorder. Treatments include talk therapy, medications, or both. What do you think that is, the obsessive compulsive disorder? That's a person that's like always cleaning up and all that type of stuff.
Compulsive means you like to do something. You overindulge and you overly do something. So it could mean a variety of things. And it's just a person that just goes overboard. But what we have to keep in mind, like I stated earlier, is abusing substances, drinking, using any type of drugs can magnify this by 1,000 times.
Oh yeah, okay. So like how we said, we don't think that should even be on the list. But if a person get to drinking and smoking and doing whatever else it is they do, that can magnify that.
Definitely, and if it's a habit, that just becomes your life, your lifestyle.
Yeah, exactly. And this right here is important. They all are important, but I feel like this is important to more important to us and affects us is post-traumatic stress disorder. I guess if you didn't had trauma in your life or seen trauma, been a part of it, at some point in your life it starts to affect you.
Definitely.
You know what I mean? And actually, just on a personal note, I ain't gonna bend y'all ear back, but when we was putting this stuff together, and I was putting these questions together to pass along to try to get some, the right information, it brought up memories of me, post-traumatic stuff, where they were saying that stuff that you seen as a kid, it affects you now.
Even things you lived.
Yeah, exactly. Then, like when I was little, I remember my mom getting, guys beating on my mom. And I never remembered that shit, bro. You know what I'm saying? I guess your brain probably lock it out or block it out or whatever. But once we brought this to the forefront, all the memories just came back. You know what I'm saying? Well, I started remembering that shit vividly. So I guess that's a form of how you cope with it, where your brain kind of block it out.
Yeah, shut it off.
Shut it out. Yeah. That was something personal that came to me. And also, a friend of mine, I ain't gonna say his name, but this is a street dude, straight gangster, man. We did gangster shit together, you know what I'm saying? So I know his pedigree. And he said that stuff that was said to him as a kid affect him now. So verbal abuse, you know what I'm saying, where people say mean shit to kids, you gotta think about that can affect somebody. And this man my age, you know what I'm saying, we going on 50. And he remembered that shit vividly, he said. You know what I'm saying? So you kind of got to watch what you say to people and watch what you let your kids see, because it affects them, going forward in life.
Definitely does. Definitely.
What else you got, D?
Yeah, adding on to what you just said, living a street life as long as we did, and a lot of the things that we were involved in and indulged in, that could, those things could give you mental health issues. Or it could do a lot of things as far as post-traumatic stress syndrome goes. Yeah. A lot of the stuff that we've done, seen, and been through. Yeah. So but we'll save that story for later.
Yeah, I definitely agree.
But definitely, that's how that go right there.
Yeah, a lot of stuff that you've seen and been through, man. Like a lot of us, coming from streets, or even if you ain't from the streets, man, wherever you from, just stuff you've been seeing in your life, man. People that that maybe died early, got killed violently, or just anything traumatic that happened in your life. It's post-traumatic, and it can cause stress, and it can cause mental health issues, man. You know what I mean?
Definitely. So some solutions that may help ease mental health. Mindfulness practices like meditation can positively impact mental health. Physical exercise has proven benefits for mental health, promoting mood regulation and reducing stress. So, working out, meditation, those are two good things right there that a person can do to keep mental health away, keep mental health problems away, or if you're having them, to reduce them. Yeah. I would have to add praying as well.
Yeah, prayer always is at the top of the list, man. And exercise, man. Like if you sitting there just thinking about your problems and letting that shit eat you up, man, find you an outlet, man. You know what I'm saying? If it's walking in the park, it might sound corny, man, but you know what I'm saying? It's relieving, man. Taking you a little walk in the park, or walk around the block, or you know what I'm saying? Whatever type of exercise that you can get into to get that shit off your mind and just to release some of that energy, man. It's a good idea. I definitely think of that. And meditation, I don't have any experience in it, and I've never done it, but I heard that that's a good way too, like you said.
Definitely. You have to have one thing about meditation. You gotta have complete silence to do meditation. So it might be hard for some people that's in a shelter or constantly like going to these churches and around other people to meditate, because you gotta kind of have complete silence to meditate. You gotta be by yourself to meditate. To really even be able to think clearly and properly, sometimes you have to spend some time by yourself.
Yeah. So ain't nothing wrong with being by yourself sometimes. You need that sometimes.
Definitely.
Peace of mind.
Definitely.
So ladies and men also, you know what I mean? If you're in a relationship, sometimes it's cool to like give your spouse or your significant other a little bit of space, man. They, ain't always, where you going? What time you coming back? Or what you doing down there? Or what you doing up there? Like, you know what I mean?
Exactly.
Sometimes just give them a little space, man. They might just be thinking about somewhere. Have something on their mind that they want to think about by themselves, man.
Yeah, definitely.
They ain't taking nothing away from you or nothing. It's just, Everybody just need that little
Everybody
alone
needs their
time.
space, you know,
Yeah.
everybody need their alone time. That's just how it is.
I also want to touch on, if you have mental health issues, it's places that you can go. But if you don't have insurance, man, which is a big deal for some people, man, you can reach out to the National Alliance of Mental Health. They'll help you out. Maybe maybe put you in some type of program or whatever you need. And they're at 2012 West 25th Street, 44113. The phone number is 216-875-7776. And again, that's the National Alliance for Mental Health.
Definitely.
Yeah.
Anybody that's out seeking help for mental health, I would say go to your local Catholic church. They should be able to help you and put you in the right place and give you the right direction to find the help and seek the help that you need.
Yeah, I agree. We're gonna hit you with some more facts, man. Research says that, according to research analysis from the National Institute of Mental Health, mental illness is usually caused by a combination of four main factors. Genetics, which is we touched on, biology, environmental factors, and psychological factors. So environmental factors, what is that? That's like where you at?
Yeah, where you living, what's going on around you.
Yeah, so
stuff like that.
Yeah, so if you living in like a war zone, you know what I'm saying? That could affect you, man. Every time you go outside, it's niggas people shooting, you know what I'm saying? Fighting, all type of nonsense, you know what I'm saying? That can kind of affect you, man. Or you might have to go in the house or get away from that shit for a little while, you know what I mean?
Definitely.
Yeah.
Because like they say in Rome, do as the Romans do.
Yeah, so that's how you on that, man.
Yeah, exactly. If you watch The Godfather, he said, think like the people around you think.
Exactly,
so,
man. So my advice to you, if you live in a war zone, you live in Chirac, or you live in somewhere like that, you know what I mean, down the way, you know what I mean, somewhere where it's just rowdy, bowdy.
Exactly.
Just try to knock you a nice young lady that lives somewhere else, man.
Yeah,
You a girl that live in one of them areas, man. Try to holler at you a dude that where maybe you can get away. You can go over her house, man. You know what I mean? Spend the night, spend the weekend, kind of, get away from all that, man. Where you ain't got the stress of worrying about somebody knocking your head off when you walk out the door, man.
Yeah, definitely.
Exactly.
Definitely. Also, sleep is closely linked to mental health. Consistent quality sleep is essential for emotional well-being.
Yeah. I get a lot of sleep, man.
Yeah. Me too.
Yeah, sleep is a big deal, man. You know what I mean? Just keep you healthy, keep you looking. You don't look all tired, and just try to get you some sleep, man. That way your body have a chance to decompress and let some of that stress go away, man.
Definitely, in the workplace environment can significantly influence mental health as well. If you're dealing with a lot of problems at work or in your workplace where you may not like your job, you may not like your boss, you may not like your coworkers, or they're getting on your nerves, or people have their favorites and you're not one of the favorites, or you're not in the clique or things of that nature, but you have to do this to take care of your bills or to maintain your lifestyle. Sometimes those things can factor into it. So you may have to look for another job, or you may have to go through the proper channels to get things around you correct.
Yeah, exactly, man. I tell this to my daughter, man, and, anybody that'll listen, because I done had a lot of jobs, man, and I know how it go. When you go to a job, man, you kind of stay away from all that, you know what I'm saying, the cliques and all the talking and all the gossiping. Man, just do your job, man.
Exactly.
You know what I'm saying? Just do your job the best you can. Don't worry about what everybody else talking about. I remember you told me that, D. That was some good advice you gave me one time. I was working somewhere, and I was like, man, damn, man, this person always doing that. And this person always, he was like, rap, man, if I was making that type of money, I would just do my own job. I wouldn't worry about somebody. And that's just real spill, man. Like, just do your job, man. Don't get involved in all that, because that's just, we already got enough pressure and enough stress. You know what I'm saying? You don't need to go to work and get into that shit and have more stress, man. So just do your job, man.
That's all. Just go there, do your job, have a laser focus.
Yeah, hell yeah, man.
And that's what it is, right there. All
right, this is real important right here, man. This is an important note. if you're experiencing thoughts of suicide or self-harm, or if anyone you care for is, this is considered an emergency. You know what I'm saying? For real.
Definitely.
And you should seek prompt help. You can call the National Suicide Prevention Line, which is available 24/7. It's free and confidential, so they ain't gonna put you out there. You know, they probably try to talk to you, man. It's 1-800-273-TALK. 1-800-273-8255. You can also text hello to 741-741. And that's the crisis text line. You know, so that's a big deal, man. If it get to that point where you talking about thinking about hurting yourself and all that, man, you know, there's always somebody you can call and talk to. You can reach out, and then I guess they'll holler at you and try to talk you down or whatever.
Yeah, definitely. How I used to deal with a lot of stress is just smoking blunts.
Smoking mad blunts.
Yeah, smoking mad blunts. You know what I'm saying?
Yeah.
Ease the stress, ease the pain.
Yeah,
you know
like
what I mean?
Pac say, rest in peace for
Yeah,
real.
rest in
Man.
peace,
You know what I'm
yeah.
saying? Like everybody deal with stress and mental illness in their own way. Cause like I said, I feel like we all suffer from some form of mental health, man. Like we didn't, like I said before, we didn't see people early deaths, people that we love, man. You know what I mean? That we miss every day. You know, they ain't here with us today and shit, man. And that be having your head messed up, bro. Like for real. Like sometimes you just be driving and you get to thinking about your partner, man. You just be like, damn. You know what I mean?
Exactly.
You know, or you can't maybe do your job, or you maybe can't interact with your family at that time. You might have to walk away, you know, and get you a moment, man.
Yeah, definitely.
And that's another thing we was talking about. Sometimes a person needs a little bit of space. You know, let them have their space, because you don't know what that person could be going through, man.
Yeah,
you know?
Definitely.
A few counseling centers around the Cleveland area are Murtis Taylor, Signature Health, a place called The Center, and a place called Highland Springs. These are some counseling centers in the greater Cleveland, Ohio area. So you can look them up, reach out to them. Like I said, all this stuff is confidential, man. So if you want to just have somebody to talk to, you know, outlet, you know, you safe talking to them.
Definitely. That's a great thing right there. And like I said, self-awareness, neighborhood awareness, you know, all around awareness is the best thing. And we're giving you places where you can get help if you need help. And we just, you know, trying to look out for the community, look out for the people, and, you know, give back to the people and just make everything aware about mental health, a problem that not just this community is having, but a lot of communities and pretty much the world is having. So we just want to, you know, give our part in the self-awareness and making everybody aware that there is help, there is hope, and that, you know, you can beat this and you can make it out of it.
Yeah, exactly, man. Exactly. And don't bite off more than you can chew is you know, a little bit of advice I got, because like you said in the beginning, financial is a big part of stress, and all that stress can cause mental health issues, man. So kind of keep focused. Like some advice I can give, you know, all this stuff that I'm saying is stuff that I went through my own self. So I ain't just like spewing out just no nonsense, bro. Like when you say like you get a job and you start making a little bit more money, you know what I mean? That don't mean go acquire more bills. You know what I'm saying? Give yourself a little bit of time as you acquire more bills, because anything can happen, man. You know what I mean? And now you're struggling and striving, and you're gonna have, it'll drive a person crazy. You know what I'm saying? So, you know, take things slow. Don't bite off more than you can chew. That's some advice I got as far as mental health, man. And like I said, don't feel embarrassed or don't feel like something wrong with you or something, because I feel like everybody, you know, suffer from some form of mental health, man. You know what I mean?
Definitely.
Even people that be millionaires, they be killing themselves and, you know, all type of shit, man.
Definitely.
So I used to think like this, D, like in the last year or so, couple years, everybody blame everything on mental health. That's all they be talking about. And I was like, I'm tired of hearing about that shit. I'm tired of hearing about it. Niggas just capping, niggas just using that as an excuse. But listen to this, man. As we opened up this box and we've been getting information from people, and researching information and stuff, a lot of this stuff I personally experienced. You know what I'm saying?
Yeah,
I'm like,
definitely,
damn, man, this is real shit. Like, I ain't,
definitely.
saying, on not to disrespect nobody that suffer from mental health and nothing like that, but I'm serious. A lot of this stuff that we went over and stuff, relates to me.
Yeah,
you know what I'm saying? So it ain't. I don't think it's fake or it just started coming about. I think it's just with the internet now, and as technology and research and all that stuff gets better, they able to diagnose it better.
Definitely.
So that's why we hear about
I
it.
feel it relates to me as well. And you gotta think it was kept hidden for a while because when we were growing up, we never heard about it.
Exactly.
You know what I'm saying? In our era, we never heard of it. They never taught, you didn't hear it as like how you hear it now.
Yeah.
You never heard about it, but people still had the same problems.
Yeah.
Or still going through the same stuff.
Yeah, back then you just got your ass whooped.
Yeah, definitely.
You was walking, acting around, acting crazy.
Yeah,
you just got your ass whooped.
Definitely.
Man,
or if you was out, or if it made you go out and commit crimes or do certain things, you just went to jail.
You just threw your ass in jail.
Nobody thought about this or that.
Yeah.
Or what if he's going through this or what happened? Or nobody didn't care about that.
Yeah, you're right, D. Because now I notice with jail, they ain't really locking niggas up like unless it's like violent. Pistols or something like that, you know what I'm saying?
You gotta be using
you gotta be, you know what I'm saying? It's a lot of stuff they just gonna they try to get you some help. You know, if they feel like you might need some help. They ain't just so quick. My point is just throw you in jail nowadays.
Exactly.
You know what I mean?
Especially if you got a substance abuse or a drug problem.
Yeah.
They definitely gonna give you a million chances.
Yeah. As long as you ain't hurt nobody, you just hurting yourself. They gonna give you a chance. Now we ain't saying go out there and do no crimes or nothing, but you know, we just noticed that, because we keep our ear to the street. We notice, what's going on, and they'll give you a chance, man. Especially if you say you got abuse problems, man.
Definitely.
So you what else you got? Do you got anything else?
I would just say in closing, I think that we're gonna stay on top of this topic, and we're gonna come back to this from time to time in the future, and we're gonna work this out with y'all. We're gonna stay on this, and this is like something that we're gonna continue to do and continue to talk about and continue to implement within our brand and within our program, and continue trying to help people and making people self-aware and making people overall aware.
Exactly. I feel the same way. We're gonna definitely come back to it. We're gonna touch back on it. Let us know in the comments if there's anything that you guys want us to touch on involving mental health, man. Because like I said, me and my man D, 5,000 watts, we both have suffered from mental health. You can see, you know what I'm saying, my hair is going at the top a little bit. Just to try to lighten the mood, man. But it's just something in our society that we wanna stay on top of, and like D said, we'll be back to it, man.
Definitely.
Also I want to give a shout out, not to cut you off, my bad D, but I want to give a shout out to Vino, VBG Flooring. He actually was the sponsor for this episode. He can be reached at 216-403-7568. He reached out and like I said, to the young lady Siobhan, and got some input for us. You know what I'm saying? Also, I want to say thank you to her again. We really appreciate the knowledge, so we can pass it forward. Vino, we want to say congratulations to him. He's opening a bar up, D. You know what I'm saying?
Yeah,
you know what I'm saying? Him and his peoples, man. It's going to be called the Cleveland Tailgate Bar and Grill. The address is 1938 Euclid Avenue. They're having a grand opening March 14th. So, be there, be square.
Definitely. We'll be there.
Of course, we'll be there. We actually gonna, we're gonna host a podcast episode from there. So, look forward to that too.
Definitely.
And that's it.
With that said, peace.
That's it, man. We're gonna wrap it up. That's a Reynolds wrap. And as usual, man, it's straight like that. And we'll see y'all next week. Peace.
Definitely.